All right, well, it's 10 o'clock and Eileen is not here today, so I'll do my first moderating of the meeting. I think of it more as a moderating than a leading. Um, so we can start by just introducing ourselves any way you'd like to, and just keep it brief. I'm Hallie Faust, Vice Chair of this committee and formerly an epidemiologist and venture capitalist in different orders. Elena? Did I pronounce your name wrong? I apologize. You're muted.
Sorry, were you talking to me?
Yeah, go ahead.
Oh,
just call everybody.
I apologize.
You don't have to say, I'll go next.
Okay. I'm Eleni Bukabalis. Good morning, everyone. I'm an emergency physician. I am calling in from Placitas, she, her pronouns. Happy to be with you all this morning. Crystal, if you'd like to go next.
You bet, thank you. Crystal Apodaca. I'm an NP hospitalist at UNMH, calling in from Albuquerque, she, her pronouns, and Haley.
Haley, not Hallie.
Hi, everyone. I'm Haley Peterson. I'm with the Substance Use Epidemiology section here at New Mexico Department of Health. My pronouns are she, her, calling in from Albuquerque today, and I'll pass it to Matthew.
Come on, microphone, work with me. Matt Clark, Terrell County, down in Alamogordo, Emergency Services Director, Emergency Manager, EMT. And I lost track of who's next.
Alan.
Alan Plymill and Deming, provider in internal med, and enjoying the beautiful Southwest weather today. Thank you.
And Gary, that leaves, well, no, I guess Brenda.
Good morning, everyone. Brenda Martinez. I'm the staff manager here with the Medical Cannabis Program.
Now, Gary, why don't you go ahead and you can.
All right, and I'm Dr. Gary French. I'm the medical director here at the Medical Cannabis Program. Thank you all for being here today. We got a great group. So, Libby.
Hey everyone, Elizabeth Bissio, you can call me Libby, she, her, hers pronouns. I am the health educator with the Medical Cannabis Program, and I am up in Santa Fe today. Again, Alan, loving the weather. It's a nice change. The coolness is welcomed.
Okay, thanks. Well, actually, Gary, do you want to just sort of step us through the agenda?
Okay, great. Well, I'm just going to start here with an update with regards to the Medical Cannabis Program. As you all know, we did go with the online patient portal. We started that earlier this year, and currently we have 47,742 patients who have registered to utilize the online patient portal. So that is a large number. I mean, it's essentially perhaps 50% of the whole program. So we are definitely making strides there with regards to patients transitioning to this online patient portal and benefiting from the number one, from the information that they can garner by using it, but also from the expeditious application process that they're able to benefit from if they utilize the online patient portal. Now, in tandem with that large number of patients are 899 providers here in the state. Oh, there's Katie, that have also signed up to use the online patient portal. So again, 899 providers, that's quite a large number, I think, here for the state of New Mexico that have registered and have their unique identification, their unique emails, and can certify patients for the program. So one other thing I'd like to do is I was going to share a little bit about our updated biography page, but as Katie has joined us, I'll let Katie introduce herself. Katie, are you there?
Hi, yeah, I'm here. Hi, everyone. I'm not able to be on video today just because of stuff happening behind me in my house that's going to be very distracting for everyone. So I will be off video, but I'm Katie Wickowitz.
and I'm at the University of New Mexico. I'm the director of the Center on Alcohol, Substance Use, and Addictions. I'm also a professor in psychology and a researcher. I've been studying alcohol and other substance use and treatments for 20 years now. So good to be here again. Good to see many familiar faces. Sorry to not be on camera.
Okay.
And mostly muted.
And
we have four squirrels living above my office, so we're dealing with that today.
oh,
Humanely,
no.
humanely dealing with it.
All right, well, I'm going to go ahead and share here. This is our Public Health and Safety Advisory Committee biography. This is available on the website, on the Medical Cannabis Programs website. And as you can see, we have some wonderful pictures. Our whole team is here. And again, I just share that with you because again, I'm much appreciate those of you that sent pictures in. And again, I think this really does help, you know, in the future as those legislators read the report that is put out, that they'll see where it came from and who helped with it. So I just thought I'd share that with you rather quickly. And I'll share more later about the work that we've done. Hallie, Haley, Eileen, Libby and I have had a couple meetings now with regards to trying to create a matrix or at least a SharePoint site where we can all start focusing our energies. And I'll talk a little bit more about that after the journal article presentation. So I'll just stop sharing real quick and turn it back to you, Hallie.
Well, let's continue on. Crystal, were you going to share an article with us today?
I am, and I will tell you, I'm a little bit, of course, always sad Eileen's not here, but a little bit glad that I don't have to like follow her in an article presentation. I'm going to share my screen here. Oh, let me figure it out. This guy. Okay. I think I got it now. Are you seeing my slide deck?
Yes.
Yes. Okay. Teams is just a little bit different from Zoom. So I am going to give a brief review of this systematic review, societal costs and outcomes of medical recreational marijuana policies in the United States. And this is the article, and here is a QR code if you want to scan it and follow along or have it for later.
Sorry, one quick question. Is this
sure.
in Terra also? Or?
No, not yet, but
right.
I can absolutely upload it there. Yes, I didn't do that part, no. I chose this article because it is high level of evidence, right? So it's a systematic review, higher on the level of evidence. And then it also has some pertinent topics that we are also interested in within our group. So background, and I'll be brief on this because this is just an overview. Increasing support of cannabis legalization, 68% of adults in 2019 compared to 12% in 1969. And the cannabis industry is projected to exceed 25 billion in revenue by 2025. There are benefits of cannabis regulation, financial gains from tax revenue decreased in criminal justice system costs, and then regulation and product testing for consumer safety. And of course, risks exist, making cannabis more readily available for adolescents. And then there's also unintentional pediatric exposure. And then cannabis remains a Schedule I on the federal level. So the research question of this article, as you can probably glean from the title, what are the societal costs and outcomes of medical marijuana laws and recreational marijuana laws in the United States? And whenever they talk about costs, it's not monetary, more like expenditure, energy, that kind of cost. So the methods for finding the articles that would fit in here is kind of outlined here. They started out with almost 4,000 and then did a second review for 378. And the articles that they chose to include were ones that were both quantitative and qualitative studies, but they excluded ones that only talked about the details of marijuana legalization or only the effects of marijuana use, unrelated to policy. And then they also excluded articles that made projections or forecasted any possible implications of marijuana policies, but didn't have any data to back that up. And then they also ones that only addressed changes in adult marijuana use as a result of policy. They expanded it to have to look at other aspects. So they initially excluded 4,000 that were duplicate. They were looking at only peer-reviewed, only US, only English, and then looking at title abstract to indicate if it was relevant. And out of all of those ones, then 291 made the cut from there, and then they excluded again 178 because they weren't empirical, not policy-based, only analyzed marijuana use. And they ended up with 113 articles, and all of these articles were studies completed or published after 2010. So the range for this is 2010 to 2021. And there were categories that were reviewed. So you look at these, and some of these probably look pretty familiar in the categories that we're interested in. And beside is for each category, the number of studies that were included with information on that category. So I'm going to quickly give a brief snapshot of each category because there's quite a few, and then kind of wrap it up at the end here. So for adolescent marijuana use, 22 studies. This one was kind of on the fence. So 10 studies found an increase with both medical and recreational marijuana law implementation. 2 studies found a decrease. And then 10 studies found no significant effect. And this is all on adolescent marijuana use. For opioid use and opioid-related outcomes, there were 25 studies. And overall, these ones showed that medical marijuana laws decreased the odds of opioid use, chronic use, high-risk use, and that's for people with commercial insurance. And then also found decreased use of opioids for pain management, as well as decreased report of opioid-related side effects. And then shout out to the New Mexico Medical Cannabis Program. So that one was specifically listed in the article, showing significant reduction in opioid prescription use, but none of the studies showed any changes in opioid misuse after the passage of the medical marijuana laws. They combined alcohol, tobacco, and a non-opioid illicit drug use, and found 13 studies combined all of those, but I'm going to piece them out by each category. So for alcohol, one study showed higher use of cannabis, the poly use of cannabis and alcohol in adults, whenever both recreational and medical marijuana laws were implemented. One study showed higher binge drinking among 8th graders when medical marijuana laws were implemented. 2 studies show lower odds of alcohol use among 9 to 12th graders with medical marijuana laws. And then 5 studies showed no changes in underage drinking patterns with both recreational and medical. For tobacco, 2 studies showed an increase in cigarette use and 3 studies showed a decrease. And out of those studies, one particularly looked at 8th graders, and this is for both recreational and medical marijuana law implementation. For illicit drug use, so it's non-opioid, 2 studies showed no impact in the past month on cocaine or heroin use for adults older, 21 years and older with medical marijuana. 1 study showed an increase in illicit drug use for those over 18 with medical marijuana law implementation. 3 studies showed no effect, and this is on adolescents 12 to 18. 1 study showed an increase in the likelihood of cocaine/crack and heroin use in the past 12 months for adolescents. And then one study showed decrease in non-cannabis illicit drug use in 8th graders, and that's with medical marijuana law implementation.
I'm sorry, Crystal, I have one quick question.
Of course. And I was going to say, please ask questions as we go. Yeah.
Of these studies, does that mean that these results, everything else was excluded, or everything else from these studies showed no impact or some impact, depending on the wording of how you summarized this?
So the ones 2, 3, 4, 5, 6, 7, 8. So 8 studies looked at the illicit drug use, and these were the findings within them.
Right. So, for example, the study showed decrease in non-cannabis use. Does that mean all the other studies didn't show that?
I guess, Hallie, I'm not understanding the question.
I think it might just be the topic of what the research was.
Mm-hmm.
The
So that
more
was their
defined
question.
scope of the research.
Yeah, yeah.
Okay.
I don't think I'm answering you, am I? Yeah, I'm sorry.
All right. No, that's all right. I just didn't know if we were there for, in all the other studies they showed, for example, the first item, you have 2 studies showed no impact. So does that mean that one study showed some impact but showed no other impact? Or I guess it's a counterfactual question as to what you're showing they showed versus what they clearly didn't show, or there was just no data on them, or?
So I guess within those studies, the 2 of them that showed no impact, they looked at the effect of medical marijuana law implementation on the past month cocaine and heroin initiation or use in adults. And both of those studies showed there was no change within their study group.
Okay, but they didn't show anything about any of the other issues that we're talking about on this.
Correct. This is just broken down for that one, for this category.
That's what I was wondering.
Okay.
Is there an absence of information, or was there negative information, but it's just not reported?
Just not reported. So within this 113, they broke them into categories. So these ones that we're looking at here, only looking at illicit drug use. The previous ones were only looking at tobacco use.
Right.
Okay.
Thank you.
Okay, you bet. Thank you.
Maybe, I haven't finished my coffee. Maybe that's the explanation.
It's okay. I hear you. Me neither. So together. Then in the category of illicit cannabis growing and cultivation, 2 studies, and this makes sense. Implementation of recreational medical marijuana laws decreased the illicit growing and cultivation of cannabis. And then they looked at employment earnings and workplace outcomes, and there were 8 studies in here. So what they found within this category, medical marijuana law implementation didn't affect employment status, hours worked, or wages. It did decrease employee absenteeism, whereas recreational marijuana law implementation increased disability claims. So that was the impact there. As far as academic achievement and performance, there were 3 studies that looked at this. So high schoolers who were exposed to medical marijuana laws increased their probability of not earning a high school diploma. And then in where there were recreational and medical marijuana laws implemented, correlated in college students with decreased time spent on academic activities, as well as lower academic achievement. And then in criminal activity, there were 10 studies. And so the overall, they found no significant relationship between recreational or medical marijuana law implementation on violent crimes, and that includes murder, rape, property crimes, or arrests. Interesting, one study found in counties that bordered Colorado and Washington, after they implemented their recreational marijuana laws, there was an increase in cannabis possession arrests. So I think we can maybe allude to how that would happen, right? Go to Colorado, then you cross back into your state and get busted for having cannabis where it's not legal. And one study found medical marijuana law implementation in Mexico border states actually decreased violent and drug crimes related to Mexican drug trafficking organizations. And I wanted to look at that one a little bit closely to see what all they looked at for that, but I didn't have a chance to. But if you have any specific questions on that, I'm happy to look at it and see what it showed. And then perceived harmfulness. So this is the perception of how harmful cannabis is. There were 13 studies, and the consensus is with medical marijuana law and recreational marijuana law implementation. There was a decrease in perceived risk and harmfulness of cannabis, so risk of driving after use, health risks, any cannabis-related consequences. And this was particularly true among adolescents, but also adults. And then traffic and road safety. 14 studies overall. Recreational medical marijuana law implementation showed an increase in driving while under the influence of cannabis. 5 of those studies showed no significant increase in traffic fatalities, and 2 studies found a relative increase in traffic fatalities with recreational and medical marijuana law implementation. And the final category, which they combined, interestingly, suicide and sexual activity. There were 4 studies, I know, 4 studies that looked at this. So medical marijuana law implementation showed associated with or correlated with an increase in sexual activity, decrease in contraceptive use, increase in number of births, a small increase in birth weight, but no effect on gestation periods or APGAR scores. So that's pretty interesting. And then medical marijuana law implementation correlated with a decrease in the suicide rate of adult males, but no significant effect on adult females. And they didn't look at adolescents in this one. So kind of the snapshot of this, there's both social benefits, negative outcomes. Social benefits, decrease of opioid prescriptions, decrease opioid overdose mortality. Inconclusive are the effects of cannabis use on alcohol, tobacco, and non-opioid illicit drug use, and no difference in traffic fatalities. And then negative outcomes, increased use in adolescents, decreased perceived harmfulness, decreased time on educational activities, decreased academic performance, and then an increase in driving under the influence of cannabis. And then I think this is an interesting one, that state-specific policies can impact surrounding areas. In the study where they found the possession arrests in neighbor counties were increased after recreational medical law implementation. So this study did have some limitations. They only reviewed studies from 2010 to 2021. And they had fairly strict inclusion criteria, right? So it had to be peer reviewed. It had to specifically have data on implementation of policy. It couldn't just talk about adult marijuana use. So they may have, with that strict criteria, they may have missed some quality studies. And then overall, we know that recreational marijuana laws are fairly young, and that makes longitudinal research difficult at this point. So for the future, of course, further investigation on the impact of recreational marijuana laws, and then can also potentially look at the cost savings regarding opioid prescriptions, and then the impact of workers within the cannabis industry, because that would be on the employment economic part as medical and recreational marijuana laws expand. Okay, any questions? That was a whirlwind.
Well, thanks. That was a great summary of the article. I appreciate that. And it raises lots of questions, but I'll leave that open for the group.
That was a great presentation, Crystal. Thank you.
Thank you.
Just overall, did you get a sense that the studies were coming from one geographic area or another? I know they included studies within the United States, but do you feel like they were mostly Colorado or Washington, or was it?
There were many on Colorado and Washington and California. There was one particularly in Philadelphia that looked at like decrease in, let me remember which category that one was under. I think decrease in violent crimes, particularly in Philadelphia with their passing of medical marijuana laws. But yes, I feel like the the states that have had implementation for longer were mostly looked at. And there were some pickings from other geographical areas. Great question. Yeah. Katie, I see your hand is up.
Yeah, thank you. And actually that was kind of related to my question, was around, thinking through, especially for any of the studies that are looking at recreational and medical, and thinking through like kind of the characteristics of those states versus New Mexico. I think that's going to be really important for us to keep in mind.
The generalizability, yeah.
Exactly. Yeah. But I just think it's such a really wonderful review. First of all, like that was such a clear and concise description. It was really fun to follow. So thank you for your
Katie.
presentation. And then I really think, the piece on academic, and maybe, I mean, this is partially because I'm at UNM, the piece on academic performance, I think, is really important, but also when we think about adolescent academic performance, right, in a state that really is focusing, with a governor that's really focusing on kind of adolescent and child, well-being and outcomes. So I think that is something that we're going to want to pay attention to and make sure that if we can dig up any other, and I could do this, I could volunteer to dig up other literature on this question, because I think we do want to keep that in mind, like, any adolescent young adult outcomes that could be adverse.
I absolutely agree. Yeah, especially with impact on not earning a high school diploma, that's huge. Yeah,
that's huge, and we don't need any more impacts on that in our state.
No, we got plenty to go against.
Yeah, or we want to make sure that we're countering that potential effect through investment in communities to promote high school diplomas, right? Like, I think we can see this as, where should resources go? And maybe that's one place.
That's such a good point.
Thank you.
Thank you.
Crystal, what's your assessment of all of this? I mean, you gave us the limitations of these studies. I'll look forward to reading it when you put it in Zotero. I didn't get the QR code fast enough when you mentioned it, but how would you evaluate this above and beyond the three limitations that you mentioned?
Sure. I think it is mixed findings, just like we've been finding in the literature that we've gone through. And I think too, looking at, as Eleni and both Katie alluded to, generalizability to New Mexico from so I think it's a nice review because at least it puts together everything that's been done. But I don't think it's anywhere near helping us draw conclusions on quite a few of the categories, right? Some are pretty straightforward, like illicit growing. So if there's laws, there's less illicit growing. But for the big impact ones, adolescent use, health, and the big ones we're looking at too, alcohol, tobacco, non-opioid illicit drug use, inconclusive.
How do you think we can use this information in the report that we're going to have to put together, assuming there will be other reviews, presumably, and other studies between now and then, but it doesn't sound like there are any solid conclusions here that we can
use. I think that we can use it as a springboard for pointing us in the direction of perhaps other research. So as we look at these articles reviewed, and then be able to see where they got their data from. I think, though, I'll be honest, Hallie, I think as we prepare our paper, that there's going to be some unknown. It's just too young. There hasn't been enough research done. So I think if anything, it can definitely give us, as Katie mentioned, places to work on, put more effort into research, and then more resources.
Thank you. Are there any other questions right now? One thing we might do, Gary, for our next meeting is include questions from this meeting so that when we can read the whole article, we might want to come back to Crystal and and bring up some additional items that might be helpful.
I think that sounds great. Yeah. Thank you. Thank you all for giving me the opportunity to present it.
No, thank you. Thank you very much. So Gary, you want to do the update on our couple of meetings in SharePoint?
Absolutely. Thank you. And so I'm going to go ahead and share the Public Health and Safety Advisory Committee's SharePoint site. I don't believe I've sent the links to all of you, but again, the reason we're using SharePoint is because it is secure and it will be for the Public Health and Safety Advisory Committee members, as well as Haley and Libby, and I believe Dominic and I are also on it as well. And it's much like Google Docs, where, you know, we can have these themes evolve. And so one thing that we've attempted to do, we've had 2 meetings in doing this, is sort of flesh out what some of the databases and resources are that we can hopefully get this information from. Again, the themes that have been given to the committee to address are rather broad and rather general. And so I'd just like to share with you where we're at. And then after this meeting, I'll be sending you all the links so that you can get on SharePoint as well. And then please add what you want. Again, Zotero has most of the articles there. If you find that some articles from Zotero definitely apply to what the theme is that we're trying to address, you can drag that over into any of these documents. So again, now we have these 2 resources. We have the Zotero and now the SharePoint. So let me go ahead and share it with you all. And again, we can sort of fashion this to be a little bit more, you know, swanky if more desired. But again, this is just sort of the cover page. And if we go to documents here, this is where we're going to find the bulk of the information here. So what I did is broke down the 8 categories here, and we'll just use child access perhaps as the starting point here. And taking a little longer to load than I thought it would, but there we go. So again, here we talked about, you know, is with regards to the theme of child access, where are we going to get this data from? And I think that Crystal, you're right, you know, identified it right. You know, the articles can maybe help us hone into where we are going to find this information. And again, different states have different, you know, databases with regards to where they're maintaining things. And I think that we in New Mexico might have some information, and we might simply have to share with the legislature that, you know, the information's not there, but what we need to address is how do we make sure we get it in the future? But things we came up with were the YRS, the BRFIS with regards to, you know, data that we could perhaps obtain that would show child access, poison control calls, the claims database. So again, if you know, through the day come up with a resource or a database that you think would be helpful, all you need to do is log in, click, and you can add it in. And we can hopefully see these pages grow and grow and grow. Other items here, these are things that we in sort of brainstorming came up with as potentially other areas that we could obtain information. For example, surveys. You know, this is something that was a theme, you know, throughout each one of these topics, is that, you know, is there a survey of practitioners? Does one exist? Is one being done? Can we create one? And then who would we seek? Would we do the New Mexico Medical Society or the New Mexico Medical Board? Maybe the emergency room physicians. You know, they're going to definitely have perhaps at least an anecdote, but maybe not, you know, a survey. They could share with us maybe information with regards to child access, but also maybe hyperemesis, you know. So, you know, developing, you know, ideas on where we could get more information. One was maybe using ChatGPT not to create necessarily an article, but to find those resources. You know, ChatGPT, I'm not so sure it's a really good writer, but definitely can find references of data and perhaps, you know, reports of child access or bringing it to school. If we put that into the search, we might be able to come up with some databases that way as well. And then, you know, charts, graphs, and illustrations. I think these are going to either come from these databases and or some of the articles. Let's go to workplace safety. This was another one where I think we came up with quite a bit of database and resources, you know, UNM, the NMSU. You know, here's the definition for a safety sensitive position. And then other items to consider would be, you know, do we address the safety of individuals working in the cannabis industry? do we seek a uniform definition of what a safety sensitive position is? Because that seems to be something that's in question. And again, I think that, the brainstorming has been great. We've come out with definitely, I think, enough ideas to where this report will have plenty to discuss year after year. But I do think we might need to hone it down to maybe just, one or two items with one or two graphs for this first year. I think that, maybe choosing one or two, or as you maybe peruse this, think about what you think is the most important theme that we want to, within the theme that we want to address. And again, that being said, I did want to share this with you. Here are some report examples from other states. I think I sent these out previously. Washington State, as you can imagine, is doing a report for their legislature as well. So is Colorado. They are at different stages in their evolution. The one in Colorado is, of course, light years ahead of probably everyone. But the one in Washington, I thought, was pretty much where, we might be with this first report. They went through a couple different categories. Some are really similar to the themes that we're addressing. Poisons, traffic fatalities. So again, what they did is they took, sort of one set of data and a rather helpful graphic, and a short introduction, and that was about it. And again, that's sort of the Vermont's been shared with me. That's sort of, I think, what we're looking for is an introduction to sort of lay the groundwork, that really potent graphic that really distills what we're trying to share and that has that data there. And then, maybe I wouldn't necessarily say recommendations because, we're presenting data and people will infer those. But, if the data is lacking, what can be done to make sure the data is there in the future? And again, here's, one about traffic fatalities, and, here's the introduction, here's the graphic, and you can walk away with that and saying, okay, in 2017, yeah, THC, the amount of THC positive drivers is increasing compared to the overall of those that are using illicit substances. So this is just sort of, one reason why I formatted these little theme sheets in the way that I did. And as we come across a graph or database, a graph or illustration, we might just want to drag it in to the pages here. Here are Hallie's notes from our meeting. We all were taking notes copiously that first time around and then, transposing them into electronic format. Well, here we can all be on this at the same time and adding what we are brainstorming about or what we think is important, or, asterisking what we really feel is the most important item to discuss in here. One I thought that was really interesting here, and again, this might be sort of the bulk of our first report is, the percentage of poison control center calls. And Haley, you had mentioned, yeah, there was the plan to have a dashboard that would monthly report the number of poison control calls, and cannabis would be one of the subsets of that. But sadly, the funding's not going to happen. Well, by golly, if that was up and running, we'd have a perfect, graph that we could share that would show that information. But, maybe we'll end up using the ER syndromic data, show, some data from that. And then, of course, mention that, and I'm not sure how much advocates will be with regards to this, but, maybe that poison control dashboard needs to be funded. And that's something, because that's going to provide the committee with the information going forward that needs to be used to really, answer the question that's been put out there. And so again, we have 8 themes here, and I think that we can probably start thinking about what are the 1 or 2 themes, really 2 themes that seem to most in one's wheelhouse, so that we can perhaps create some subgroups that can tackle these on their own. And again, we want to open this up for everybody to utilize and participate. One thing we might want to do is, as the full committee, click on, go to child access and then open it up for the full committee to add their 2 cents. Now, again, I think we can do that independently because we have access to the SharePoint. But as we get more and more information, maybe that's something we can do during some of these more, themes with meetings with everybody, is tackle 2 or 3 of these at a time. But I do think when it comes to writing, if there's an affinity you have for some of these themes, I'd say manifest it so we can perhaps start assigning these to smaller groups. So that is available. I'll be sending that link out. If you have any issues getting on it, please let me know, and so we can resolve that. And yeah, that's all I wanted to share. Does anybody have any questions with regards to SharePoint? And if you don't like this format, by all means, you're welcome to create a new one. Yeah. Haley or Hallie or Libby, what did you have any insights from the meetings as well that you'd like to share?
I think the way you set this up was very useful. I mean, I first looked at it before our last meeting last week. Do you want folks to put any thoughts on each of these sheets, or are they primarily thoughts related to where we can get data, or major questions of policy, would you say, Gary?
Well, again, I think that, and I need to stop sharing here, but under the other items, I think was where we came up with sort of those gee whiz, like, you know what? Do they check for impairment when trucks are weighed? And I think what that offers is potential themes in the future. I think that we're going to be probably a little bit more general this year, but like testing at checkpoints. I think that these were brainstorm ideas that are pertinent. And so I would just put those here. The databases here are definitely where we're going to obtain the graphs and a lot of that hard data that we want to present. So I welcome anybody to add whatever that they want. Again, this is for everybody here. And then when we sort of assign those subgroups, then we can sort of ferret out what it is that we want to focus on. I don't think we'll able, road safety and driving while impaired, we talked a bit about the DPS, or the DRE training. Maybe that's sort of the message that we want to share, that DRE training had a positive impact on officers evaluating the scene. And so, a legislator could take from that, well, gosh, maybe that's something we should fund. Again, we can't necessarily make the recommendation that it be funded because, again, the medical cannabis program is a subset of the executive, and if we can't commit the governor to funding things that the governor is unaware of, obviously. But yeah, I mean, I think the more information, the better, and then we'll probably hone it down, but we'll have this as a template for years going forward as well. And so we can come back and revisit, I really like that idea of checking for impairment when we weigh trucks. Why don't we maybe, that's an interesting idea, and maybe we can work it into presentations, rather reports, going down the line here. So, and I'll stop sharing.
That's great, Gary. I like the idea that you have that it's a place to kind of gather the data, and then, year by year, we can kind of hone in on one of the subjects. So, we have this large amount of data, and then, we'll focus on, traffic stops or just training more officers or whatever for each one of the topics. So, thank you for kind of putting that all together. It's really great.
Yeah, it sort of dawned on me that, a lot of what we might be stating in this first report is that, needs greater research, needs greater data. And I think that, Crystal, you touched on this, is that the data that we do end up with might not be quite as specific to the theme, but we can present it and then see, do the databases get enhanced, going forward. The dashboard, I mean, I'm like, that almost seems like an easy one where we're being asked point blank, what are the poison control percentage numbers? And it's like, well, we have a wonderful dashboard that's not even being funded right now. The answer is probably fund it, but how do you say that in a real neutral way as well?
And I will say, I think you know, the legislators too might have ideas of where they, you know, they'd like more information. So, you know, we can either take it or leave it. But I think, you know, after this first year, they might say, oh, yeah, you know, how about, you know, impacted driving with kids in the car or whatever it might be. I think that they might help guide the report as well in the future.
And so one thing that I'll just propose to the group here is one thing that we really did talk a bit about was surveys. Like, how can we survey fellow practitioners, fellow providers? How is the best way to do that? You know, reaching out to the New Mexico Medical Board and saying, give us the name of all your providers might not be something that we'll be able to obtain. But if someone has connections with your professional society, do you think that, you know, there's a way to survey them? We also talked about the idea of a learner. Perhaps maybe there's a student that is at, you know, UNM or a grad student that is, you know, this is a hot topic for them. They're already thinking about, you know, cannabis themes, and here they're already developing a survey. Maybe there's, you know, an ability there to invite them to, you know, participate. You know, I'll have to make sure that that is something that the committee can do. I need to look at the regs to make sure that we're not stepping out of bounds, but those might be some of the unique resources that we could try to tap into with regards to surveying, you know, because again, this New Mexico specific data, the questions haven't been necessarily being asked. And so, you know, we get to ask those. And so what is the best way to do that?
You know, Libby's suggestion that for the future that legislators may help guide us, but is there somebody either who sponsored this legislation and pushed it hard who we might want to informally talk to say what would you like to see even for the first report? We might sit down with them informally and just ask them what their interests are. And or somebody who heads the committee that reviews these laws, you know, who would have even a little more power associated with that. And we have maybe 8 more meetings, plus or minus. We're meeting, what, every 2 months approximately now, or every 3. So if it's every 3 months, we have 4 more meetings, basically. If it's every 2 months, it's maybe 8 more meetings. So we need to get on to this. And I think the structure you've given us is good. What we might add to the SharePoint is, for example, introduction, and people can put their ideas of what ought to go into the introduction. Do you think, does Zotero work like EndNote, where you can link references into Word, for example? Could you link references into these various files, Gary, do you know, or Libby?
I think you can.
Yes, it does.
Paste.
I can answer that question. It does work that way.
It does. So we can start adding references that we might want to add into our report as we review them in Zotero into the appropriate line items there. Or if it's a broad report like the one that Crystal just reviewed, that might be an introductory reference for us. No matter how we use it, we can talk about how we use them another time. Other comments or questions?
I think, yes, Gary, wonderful in the format of it. And thank you for including the reports from other states, because that's helpful to kind of see how other people have done it. I think in regards to time constraints, as Hallie's mentioning, I think the use of learners to help with surveys is an incredible idea. And even potentially multidisciplinary, more than one learner. And I think I would love to help with that if that's something we can pursue, because I think we'll get a lot of work done going about it that way.
That was Eileen's idea, actually.
It
so I give her
surprise
all the
me,
credit.
yeah.
Yeah. And I know that you work closely with Eileen. So yeah, I mean, Eileen thought of that. And so maybe you could speak with her next time we, you know, and find out what further ideas she had in mind. But And then I do, for example, the article today, I do think that, what's worked in other states is always something that we can include as well. It's a unique way of sort of recommending something, but without making the recommendation, what's worked in other states. And so if we, aren't lucky enough to find data real specific for New Mexico, that might be something we can utilize to sort of fill in the gaps. All right, well, I'll turn it back to you, Hallie.
I'm just going to say other thoughts or comments on this. I mean, I think it's a good way to organize it. Maybe before the next meeting, we could do a specific email solicitation or some sort of solicitation of each member to say, are there specific areas now that you'd like to be directly involved with? And it can be more than one. And those groups, if there are 1 or 2 or 3 people in each of those theme groups, they could get together separately. Are there public meeting rules that they'd have to meet, or if they're meeting just with 2 or 3 folks, it's not a full meeting of this committee?
I do not think that, I think groups of 2, probably number 1 would be fine. It would be more adept. And I think the full committee is the one we, would of course record and publish, but I think that just for the dexterity of people meeting and meeting more often, having it just, groups of 2 should just be fine. I will include a final, comment on that when I send out the SharePoint link, but also perhaps, Libby, we should do a doodle poll, or maybe you could rank, 1, 2, 3, what are the top 3 themes that you would want to participate in? Because again, there's no reason why, as a team of 2, you couldn't, start meeting when it's conducive and useful. And then, as we meet with the full committee, do a roundabout and see what where the progress is in some of these themes and topics. And so I think we'll fashion maybe a doodle poll, or just simply ask, please rank the top 3, and then we'll try to assign those. And perhaps if somebody wants to be part of every one of the themes, then by all means, I think we could do that. I don't think we have to publish or record when 2 members want to meet, and start discussing the topic. So
can you give us guidance? Is it 3 members or 4 members, or just to be clear? I mean, there may be 2 folks who want to do child poisoning, for example.
Well, I think there's not, it's really up to the committee to decide how many they want on a theme. If you want, I could definitely see participants wanting to be part of, all or 4, what have you, that are, most in their wheelhouse. And so I don't think we have to limit it to a specific number.
No, I mean, I'm sorry. I mean, let's say there are 4 people who want to be on the poison theme, does that exceed the limit of where you have to record? I'm just asking for some guidance.
Again, this is a committee, and we're not actually setting regulations or policy. So again, the fact that we aren't voting and changing policy, or voting and doing regulations, enables the committee to meet without the constraints of all of the other public meetings where those type of policy changes are taking place.
Gotcha.
So I think it can be rather informal, and if there is 4, that whenever the people can meet is when you would want to meet.
Sure. Great. Okay. Thank you. Well, our other item on our agenda.
I think Katie had her hand up.
Oh, I'm sorry, Katie.
It's okay.
Thanks.
Oh yeah, thank you. I just didn't want to interrupt because those were some of the questions I had too. So thank you for asking those. I just wanted to follow up on the learners that I don't have someone in mind, but I can certainly reach out to our investigators, postdoc students, to see if anyone's particularly interested in pursuing some surveys in this area. I also wanted to note that UNM does a student lifestyle survey every year, and I can get access to those data. And I'm pretty sure, I'm going to double check and I can report back, but I'm pretty sure we asked some questions about recreational and medical use in that survey. So at least we'll get a snapshot of some data from UNM students. And we have prior years data too, so we'll be able to look at changes from those surveys. I also wanted to note that an investigator at CASA did do a right before the law went into, right before the dispensaries opened for recreational, she surveyed several New Mexicans. I think it was maybe close to 500 in kind of a random survey. And then she has repeated that twice, I believe, since April of 22, right? So we also, or 21, sorry, bit confused. But anyways, we'll have those survey data too. So I just wanted to let the committee know that there are a bit of survey data that we will have contemporary that's already been collected. And now again, it's not collected for this committee, it was collected for these other purposes, but I think it will provide some context at least for some of these areas.
Interesting to find out also if they collect the same kinds of information, assuming this is good information for what we need at New Mexico State and some of the other institutions. So we get a broader look even than UNM, but we could certainly start with the UNM look. That's great.
Yeah, we have been, the person who does it at UNM has been consulting with NMSU. I don't believe they've done the survey yet, but they're actually going to be using some of our survey resources. So as soon as I know more about that, I can let the committee know.
Other comments or questions? Are there any other items that the committee members would like to raise at this time? Any thoughts about organizing what we're doing, like on SharePoint, or thoughts about what future agenda items ought to be for the next meeting or two? Okay, we'll leave it to the creativity of Gary and Haley and some of the others at DOH then.
If anybody wants to present an article, next time we're taking any and all people who want to share. So let us know. It doesn't have to, you don't have to make this decision right now, but just shoot us an email and we'd love to hear from you.
And actually, we might consider, if we can, sending those articles out in advance so that we could read them as well in advance and then be able to ask additional questions. Anything else, Gary, from your end?
Just when to schedule the next meeting.
I'd like to suggest the 31st of October, if that's possible for everybody.
So do you want us to wear our costumes that day or?
Actually, it could be the 24th as well. I thought I was going to be at a conference, but I see that ends just before that. So is there a preference, the 24th or the 31st?
My vote would be the 24th.
Either
But I could do
works for
either,
me.
yeah.
You don't want to come in costume is what you're saying, is it?
It's also my birthday.
Oh.
Yeah.
Well, do we have funding for cakes? Birthday cakes, Gary? No? Maybe? No, all right.
I'd be happy to make one.
So is there consensus, 24th? Okay, sounds good. Well, we'll see you then. Please respond to whatever the mechanism is in requesting what themes you're interested in before then, and start looking also in the Zotero. I had to pull that up. Do we have we organized that perhaps in the themes as well? I guess a lot of them are. So so you can start reviewing any literature that may be in there, or adding literature as you come upon it. You know, go to Google Scholar. I don't know how ChatGPT works today. If you ask them for references on X, I haven't tried that yet, but you can try that, or Google Scholar certainly is pretty good. So Well, thank you, everyone. We'll see you next time. Enjoy the rest of the summer and early autumn.
Hallie, was that October 24th?
Yes.
Thank you.
Same time, 10 or 10:30?
10.
I think we do 10. Yep.
Okay.
Thanks everyone for being here. We'll see you soon.
All right.
Bye-bye. Thank you.
Bye.